Hi all, my name is Suyuan Chao. You also can call me Selena, and today we'll talk about the Medicaid. So, what is the Medicaid? The Medicaid is a joint federal state program, and it's comprehensive coverage of healthcare and long-term service and supports to more than 90 million low-income people in the United States. And also, Medicaid's paying for long-term care for the poor and some middle-class older person. So the benefits for the Medicaid, they have access to medical service for adults with disability further improved, and it's like 1 in 4 work age adults has at least one disability, but the health disparities faced by people with disabilities are often overlooked in public health discussion and research. The Medicaid expansion proved a new eligibility pathway that allow low-income adults with disabilities who do not meet traditional Medicaid's strict criteria for Medicaid disability to participate in the expansion. So, did the Medicaid all have the benefits, or I think they also have some little problems. So there are the two biggest problem. The first is many people cannot successfully get the Medicaid, also can't easily get the Medicaid. And also another one is making the drug become crazy. So let's talk the first problem is many people cannot successfully get. Well, the expansion of medical program has improved the health and social needs outcomes of its members. Fighting on improvement in health equity are mixed. The Medicaid expansion resulted in greater declines in the uninsurance rates almost among Black and Latino populations compared to white. In addition, other studies have shown no record eradication in disparities between Black and white Medicaid members in terms of flu shots or cancer screening, something like this. And another question is drugs. The first is the biggest problem, that is opioid. There have the case for opioids is the mania reveals how one governors attempted to use the opioid pandemic to justify medical expansion. This governor's Janet Mills' first executive order rushed to swiftly implement the Medicaid expansion and positioning it as one of the actions that would save life and prevent substance abuse disorder, which is the same is still clearly visible in her office website. Right now, despite the massive campaign, Miney recorded its third consecutive years of record high drug overdose death in 2022. And there have the graph, the table, you can see the number is very huge. So this is a big problem. And also, there have 14 of the 15 states with the highest overdose rates are Medicaid expansion states. So there have a lot of studies shows that there have some states they already did the Medicaid expansion, and the people died because the overdose rate very high after they do the Medicaid expansion. because a lot of people, they will buy the opinion, and because the thing is in the like Medicaid expansion, so people can more easily get that. That is the big problem. Then what the Medicaid, like the relationship with NAS Code of Ethics, the Medicaid aligns with the NASW Code of Ethics principle of service, as it aims to provide healthcare services to low-income individuals and families, which is consistent with the social work professionals' missions to help those in need. And also, Medicaid aligns with the NASW Code of Ethics principle of the social justice. And the social justice, by addressing healthcare disparities and serving to provide equal access to healthcare service regardless of an individual socio-economic status. And the last one is Medicaid also aligns with the NASW Code of Ethics standard of competence, as it involved professionals who are trained and qualified to provide healthcare service to the beneficiaries. And those two is just the things which is aligned with the NASW code. I choose, but they also have a lot of just thing, like a lot of the medicated aligns with the NASW Code of Ethics. And my question to discuss is, beside the Medicaid program, how do you think one should balance the moral responsibility of providing basic health care coverage with the economic challenges of managing limited resources? And thank you for listening.